Good morning, afternoon, everyone, and thank you for attending my presentation. I'm going to present to you today our cluster analysis of the chiropractors' responses to a survey that we gave them to characterize the chiropractic care of women in the perinatal period. So to begin, I again want to thank the practice committee for giving me the opportunity to give to you my presentation, our research on this topic. And of course, I want to acknowledge my supervisors for my PhD program, Professor Stephen Myers, Dr. Elizabeth Emanuel, and Professor Sandra Grace. And of course, without the help of our biostatistician, Dr. Andrew Wetton from Kansas State University, this cluster analysis would not have been performed. So I don't know if most of you know, but among the alternative therapy practitioners, chiropractors are the most established and third only to medicine and dentistry. In a historical perspective on chiropractic pregnancy care, Gibbons proposed that D.D. Palmer may have been the first chiropractor obstetrician. And he also proposed that D.D. Palmer was of the opinion that chiropractors should be taking care of women in the perinatal period. So what we see historically in the first half of the 20th century is that chiropractors were able to provide primary maternity care. In the last 20 years, however, due to scope of practice issues, malpractice issues, chiropractors have been relegated to basically taking care of pregnant women with mostly musculoskeletal symptoms, low back pain and pelvic girdle pain. Our research team have, in the last couple of years, been able to publish that pregnant women not only go to chiropractors to take care of these musculoskeletal symptoms, but also for wellness care, along with addressing a number of non-musculoskeletal symptoms such as nausea and vomiting, constipation, and acid reflux, as well as pregnancies that involve breech or fetal malpositions. So yesterday I presented our scoping review on the chiropractic care of pregnant women, and what we found overall was that the literature is lacking. Furthermore, the literature actually is composed of four main themes. That is, the manuscripts describe the care of pregnant women with musculoskeletal complaints. The other manuscripts describe the care of pregnant women with musculoskeletal complaints, as well as comorbidities that necessitated or elevated the complexity of the chiropractic care provided and necessitated some kind of a collaborative effort with other specialists. It also describes the chiropractic care of pregnant women using the Webster technique, and very early on in the publications of pregnancy care and chiropractic, advocacy for or promotion for chiropractors to take care of pregnant women, advocacy for collaborative care with other perinatal providers, and manuscripts that describe instructions on the management protocols of pregnant women with various comorbidities. So in the overall picture, to address this deficit, we surveyed chiropractors' experience in chiropractic perinatal care. And what I'm going to present to you today is the cluster analysis of the responses of these chiropractors to a very large survey that we gave them. So we surveyed US and Canadian chiropractors if they were members of the International Chiropractic Pediatric Association. This is a professional organization that provides a large number of postgraduate seminars on pregnancy as well as pediatric care. These chiropractors had to be currently enrolled or have completed the ICPA program. They had to be, of course, practicing in Canada and the United States and actively engage in the care of pregnant and non-pregnant women. The survey content was composed of 136 items where we wanted to look at characteristics, practice characteristics, such as the clinical protocols employed, the collaborative efforts of chiropractors in the care of pregnant women, what were their safety attitudes, what were their, again, practitioner characteristics, such as their age, gender, postgraduate education, practice volumes, and we wanted to know certain patient characteristics, such as their motivation for care, and what are they coming in for, whether it's musculoskeletal in nature or non-musculoskeletal. In terms of our methodology, of course, we utilize descriptive statistics in terms of mean, standard deviations, and proportions. And again, what I'm going to present to you today is our cluster analysis utilizing a hierarchical or agglomerative clustering model. And again, we use the statistical software R for this purpose. Now, these equations may seem complex, but think of the clustering analysis as involving the responses of these chiropractors as being present in a three-dimensional space as a dot. In terms of the clustering analysis, the dots are basically clustered depending on how near the nearest cluster or dot is. And basically this process goes through an iterative process where eventually all the dots are in one cluster. However, sometime during this clustering process, a number of clusters are able to be identified that contains most of the practitioners and their responses within these clusters. So as a result, we found 3 clusters where in cluster 1, there were 56 responders. In cluster 2, there were 180 responders. And cluster 3 were basically responders that did not provide a number of responses. So again, these cluster 3 were basically non-responders. And for our presentation today, I basically ignored them. Our response rate was around 17.5%. We started out with over 2,000 email invitations, 68% or 1,412 chiropractors opened the email, 542 managed to access the hyperlink to the study itself, 399 initiated, and eventually we had 247 completing the survey. So if we look at some general characteristics of the responders in terms of their gender or years in experience, as you can see here, cluster 1 were composed mainly of what I would refer to as mid-level years of experience type of chiropractors, male and female, whereas cluster 2 were composed of early career female chiropractors and late career male chiropractors. In terms of their primary chiropractic technique, again, not surprisingly, if you're actually familiar with the care of pregnant women, Webster technique was very popular in both clusters, indicating or implying that this should be standards of care. That is, if you're going to take care of pregnant women, you should be learning the Webster technique. In terms of secondary techniques, again, what we see here is that in both clusters, a number of chiropractors indicated that they use diversified technique. Now, diversified technique is commonly characterized as high velocity, low amplitude thrust type of SMT. But here, diversified technique was characterized as a combination of techniques. And then of course, in both clusters, you can see here, again, a variety of techniques that they've employed, which are mostly characterized as low force and non-force techniques. So we asked the chiropractors, how would you manage a pregnant woman with a number of comorbidities? And the example I'm using here is a pregnant woman with fibroids, a pregnant woman suffering from low back pain, or gestational diabetes. And as you can see, in terms of cluster 1, we see chiropractors looking or approaching the clinical management from the point of view of, is there an absolute or relative contraindication? Whereas in cluster 2, the chiropractors here would proceed with a clinical workup, for example, a history and a physical examination, provide chiropractic SMT, and then refer to the specialist that is appropriate. In terms of the adjunctive therapies or whether they have collaborative efforts with licensed mental health professional, we can see here that in cluster 1, the chiropractors are more apt to use exercise and active rehabilitation, whereas in cluster 2, they are more likely to use soft tissue therapy in the form of massage or myofascial release. In terms of their collaboration or referral, cross-referral with a mental health professional, those in cluster 1, the majority indicated that they did not. And in cluster 2, the majority indicated that they did. So in terms of motivation for chiropractic care, Again, this really speaks to what Tanya was talking about earlier on. Again, what we see here is that for both clusters 1 and 2, a large proportion or a significant proportion of their patients were continuing on from their non-pregnancy status to their pregnancy status. And for cluster 1, what we're seeing is a number of chiropractors whose patients were motivated by what would be described as wellness care, that is to enhance their functioning, their adaptability or adaptivity, and enhance their well-being. Whereas cluster 2 is what Tanya described as centrists. That is, yes, they are wellness care practitioners, which is commonly associated with subluxation-based chiropractic care, but they're also symptom care. That is, they're looking at pregnancy-related musculoskeletal and non-musculoskeletal care. The variables that we looked at that had the greatest similarity is basically in terms of their attitudes on safety, their use of massage therapy, and whether their volume was affected, or patient volume, that is the number of patient visits they saw per week, was affected by the COVID-19 pandemic. And as you can see for both clusters, cluster 1 and cluster 2, they were of the opinion that chiropractic for pregnant women is safe, or very safe, and that they commonly had a professional relationship with massage therapists, and that their practice volume by far and large were not affected by the COVID-19 pandemic. So I gave you a lot of data, but here's a summary table to examine the similarities and differences of our 2 clusters. Cluster 1, again, being characterized by approaching pregnant women with comorbidities as looking at them or looking at for the presence of relative or absolute contraindication to SMT care, whereas cluster 2 practitioners would perform a clinical workup, provide chiropractic SMT, and then make the referral. In terms of cluster 1, the general trends are they're more likely to alter their chiropractic technique. As you can appreciate, pregnant women are carrying a fetus, and again, with the presence of a number of hormones, their range of motion and the joints are actually more prone to injury. Again, I'm referring to the presence of relaxin. So chiropractors in cluster 1 were more likely to change or alter their technique to a more non-force or less force technique. Cluster 1 practitioners had a higher frequency to, again, practice a wellness model and to utilize exercise and active rehabilitation as part of the adjunctive therapy. Cluster 2 practitioners were more likely to alter their technique throughout pregnancy. They have a higher frequency of connection to mental health practitioners and, again, symptom-based care, and a higher frequency of using massage therapy as an adjunctive therapy. In terms of their similarities, again, the use of the Webster technique, they were all of the opinion that chiropractic for pregnancy care was safe. They all have collaborative efforts with massage therapists, and their practice volumes were quite steady during the COVID-19 pandemic. So in the way of a discussion, again, even though I presented to you here just part of our findings in the survey of chiropractors, what we actually did was provide one of the most comprehensive examination of characterizing the chiropractic care of pregnant women. And in terms of practice characteristics, what we found in our scoping review is that basically a number of characteristics that I've listed here have been scattered in only a handful of studies, whereas now our study will provide the most comprehensive examination. The hypothesis behind the differences between the 2 clusters that I've just described may be due in part to clinical experience. Again, from my point of view and those of others, the longer a chiropractor is in practice, the more likely they are to become a holistic, vitalistic wellness practitioner. And the differences may be in terms of their chiropractic bent or philosophy, or as Tanya called it or referred to as identity. That is, are they more subluxation based or are they more centrist? So in terms of our findings, we hope that This will encourage others to further explore the clinical management approaches of chiropractors in the perinatal period. And of course, our study is not without strengths and limitations. And again, our data, our clustering analysis was based on surveys and self-reports. And as we all know, they're fraught with recall bias. Our use of only members of the ICPA that have had postgraduate or currently were in postgraduate training that required their access to the internet, again, resulted in selection and exclusion bias. And I think 17.5% is a very low response rate compared to our previous studies. This in itself, along with the biases involved in our study, point to, again, caution with the generalizability of our findings. But in defense, our study was not to come up with a representative sample, but rather come up with data from practitioners that are educated in perinatal care and have clinical experience in perinatal care. And certainly in terms of our cluster analysis, the data that we used had great external validity in this respect. So in conclusion, our cluster analysis found responders that thought that pregnancy chiropractic care was safe, and they commonly used the Webster technique, and they differed in terms of their professional identity and clinical approach through their differences in the motivation of the patients in terms of the type of care that they provided. So we hope that this will inform chiropractic education and research, inform clinical practice, as well as policy in the antenatal and perinatal care of women. Thank you.
Thank you very much, Joel. Thank you. No problem. No problems there, Joel. You followed up admirably after the previous two presentations. Thank you. Very good.
Well, at least I did something right.
You absolutely did. That was very interesting research, and I can see that that is going to be very valuable to your chiropractic industry. So I will hand over now to the floor and see if we have some questions. Yep.
I need to go up there or just speak here?
You can ask it from there.
Oh. Hi, Joel. Thanks for that presentation. I missed the very beginning of your presentation, and I don't know if this is directly related, but I was just wondering: is chiropractic care covered under Medicare? And if so, I mean, or if not, could this perhaps make it I don't know, add to the, I don't know, like health credibility of chiropractic and have it become part of Medicare?
So in Canada, we're, again, about 10% of our practitioners responded from this cohort of 247. The majority of chiropractors are actually chose to delist themselves from the healthcare system. As you know, in Canada, as with Australia, there's a universal healthcare system available, but that's only for medical care. Chiropractors are delisted, so they're basically cash practitioners. So one of the things that we asked in our survey was, are you being reimbursed through cash or insurance? And the majority actually indicated that for pregnancy care, they were reimbursed by cash. And that seems to be the trend in the United States. And I don't know if, again, in the totality of the profession, 60 to 70% of chiropractors' fees are reimbursed by insurance. But when it comes to pregnancy as well as pediatric care, the majority of the chiropractors, at least in my camp, or those that I've surveyed, have indicated that they're reimbursed by cash. Does that answer your question?
Yeah, it does. Any idea? So why would any idea why that would be? Why they would tend to want cash rather than insurance? Or
well, a lot of it has to do, and again, this is just based on my own experience in clinical practice, is just to put it bluntly, there's just such a hassle with billing insurance, and there's a lot of hoops that you have to go through. There are certain restrictions that are put in place. So when all is said and done in terms of the reimbursement, I can recall being told by third-party payers that, we're going to pay you what we pay everybody else in your area. And there's really no way to confirm that. And again, your billing is cut. And at the end of the day, you're not making more than somebody flipping burgers at Burger King. So you can't run a practice that way. And that's why most chiropractors go to cash.
Hi, Joel. It's Curtis Rigney here. Thanks
Curtis.
for your presentation, and congratulations in getting this far in your research. I have a question about outcome measures. You're talking about what chiropractors do. Is there any? Are you going to be looking at the measurement of the outcomes and the success, or what the patient's experience is from this chiropractic care?
Yes, thank you for asking that question. Actually, what I presented today is just one of the aspects of my first study. So one of the things I've done in my PhD is characterize pregnancy chiropractic care, and I've presented to you part of that. The other aspect of my PhD is from the patient perspective, and the outcome measures I've looked at is basically health constructs, focusing on sense of coherence, locus of control, and general self-efficacy. And one of the things really that I'm interested in is, are women who are pregnant different from women who are not pregnant that are attending chiropractic care? And then looking at the literature, are pregnant women attending chiropractic care different in these constructs to other patient populations? So I'm in the process of crunching those numbers now. And then again, I'm utilizing a mixed methods review. The third part of my study is to interview pregnant women and again, focus on, aspects of their chiropractic. How did they become chiropractic patients? And look into their sense of coherence, self-efficacy, and locus of control in the context of their pregnancy chiropractic care.
Thank you. Thank you, Joel. That's the questions we have from the floor. So thank you again for joining us.